Hello and welcome to India Top Doctor. Today we will talk about podiatry. And for that, we would like to invite Dr. Sanjay Sharma. Dr. Sanjay Sharma is the founder of APTA Foot Secure, co-founder of Yostra Labs Private Limited. He is an inventor and has several patents in his name in telemedicine, medtech, diabetic foot, and wound care. He has over 18 years of experience in providing healthcare. He was also awarded the fellowship in podiatry by the Royal College of Physicians and Surgeons in Glasgow. He is the seventh doctor from India to have been awarded this fellowship. So let's welcome him. As you know, sir, today we'll be talking about podiatry. So before we move ahead, can you tell our audience what is podiatry?
So podiatry is a branch of medicine which deals about foot and ankle. We see podiatry being in practice for almost about a century in the West. It could be UK, Europe, US, and other things. But in India and the Southeast Asia, we don't see podiatry being defined as a branch of medicine. And these days it is kind of picking up for various reasons which we are going to discuss going further. But for a layman's terminology, anything to do below knee will come into a branch of medicine called podiatry.
So why is it the need of the hour for the society right now?
Today, if you see, India has been. I would rather give about three reasons today. First and the foremost reason, India is seems to be getting to a place where it is going to be a diabetic capital of the world. It is the second. It has the second highest diabetic population in the world right now, with about 70 million population, and 50% of the diabetic population has a complication called diabetic peripheral neuropathy or diabetic vasculopathy, which affects the feet, where it leads to ulcers, which doesn't heal for almost about a year or so, and it might also lead to amputations. So going with the global standards, every 20 seconds, like we have started speaking about 15 seconds before, and in this 15 to 20 seconds one limb would have been lost due to diabetes. And in India itself there are about 14 lakh amputations that happen due to diabetes. And podiatric interventions in terms of foot and ankle care would can prevent these amputations up to 80%. And this is not just that I'm saying, there has been a published papers according to this, and why podiatric interventions can prevent diabetic foot amputations. So this is one part of it where we will be preventing amputations and preventing mortality also, because one more study that recently in 2022 what got published was uh, diabetic foot ulcers, amputations, mortality after an amputation is higher than cancer. So you can see that this diabetic foot condition is something that has not been given emphasis in any of the public health initiatives, but still the mortality and the morbidity is pretty high, and podiatric interventions can prevent it. The second part why podiatry is important today is for any of the aches and pains of the foot and ankle. Like somebody might have a small heel pain, or the pain in the front of the feet, or an ingrowing toenail, on various of the small things. You usually tend to go to a physician or an orthopedic surgeon going there. And if the orthopedic surgeon is in a city, probably like Mumbai or Bangalore, something like that, he might order some investigations, including an MRI or things like that. And if he finds something in the bone or in the tendons or the ligaments, then he will try and do a surgical intervention or prescribe some medications. But if nothing is found in these investigations, he just would say that, okay, go and meet a physiotherapist or give some painkillers. And this has been a practice, nothing wrong with it, but as we have not been trained in the foot and ankle care, or what we call it as a biomechanics of the foot and ankle, the way we walk, the way we stand, how much footwear difference does it make, and other things, we don't usually see how the patient is walking or standing, and that is what is typically required when we really do not figure out a way in an MRI or something like that, and what is happening with the feet. So for all the aches and pains of the foot and ankle, a podiatric intervention should be required, where we assess how a person is standing, how the person is walking, what is the kind of footwear that is using, and various of these things. So that is where the podiatry comes into play, including pregnant women. Most of the pregnant women have some kind of a foot problem that they come up with, and an early intervention for them would also ensure that these foot issues do not come in. Last, I wouldn't say last, but one, the sports injuries. Almost 50% of the sports injuries are based on foot and ankle injuries, and these things can be prevented with a right podiatric or orthotic intervention. And even today, that is not being practiced in India or the Indian subcontinent per se. uh, Patients with rheumatoid arthritis, osteoarthritis, having knee pain, low backache, and these issues, which doesn't come into an orthopedic category or a physical therapy category. There is a category of podiatry which deals with foot and ankle, where these things can be addressed. And why is it so important? Is the foot has almost about 25% of the bones that the body has. So we have almost about 33 plus, joints, and 100 plus ligaments and tendons, and with so many structures in place, and all of our body weight is on your feet when you're standing, when you're walking, and other things. And this gets often get ignored, and without taking care of it. And these leads to a lot of issues which can be prevented early on, not just the diabetic foot, but various other issues that we discussed.
All right, sir. So as you mentioned quite a few problems, is there any major problem which is treated by a podiatrist?
Yeah, so as we discussed, the first and the foremost, at least in India, why podiatry is coming into the forefront today is treating a diabetic foot condition. It could be started off with the basic diabetic neuropathy, where the person has varied sensations in the foot. It could be tingling sensation of the feet, or numbness. It could be something like a sponge being there. So various of these neuropathic conditions. It could be vascular conditions, where the blood circulation to the feet is compromised. uh, and it could be diabetic foot ulcers, where there's a huge ulcer which doesn't heal. So these are the conditions which are treated by a podiatrist. There could be a lot of sports injuries. It could be ankle sprains, it could be fractures in the foot and ankle region, or which are treated by the podiatrist. It could be common ailments, as we discussed. It could be plantar fasciitis, which is pretty common, like early morning pain in the feet. When, like, when you get up, you have a pain in the feet, or when you're walking, you have a pain in the feet, uh, or in the on the front of the feet. It could be ingrowing toenails, which is again pretty common. So these are from the commonest conditions, uh, to a complex conditions like diabetic foot ulcer is something a podiatrist can look at. And as I said earlier, anything that goes below the knee is something that the podiatrist can look at. It could be from the skin perspective, it could be from the bone perspective, it could be from the soft tissue perspective. All of these things comes under a podiatric specialty, and a podiatric surgeon or a podiatrist, so as to call us, can be treating these conditions.
All right. So, sir, can you let us through the journey of how is it diagnosed?
From so various conditions. So typically, some of the things that we usually do not see in a regular hospital, it could be large hospitals in your city, where you do not see the proper screening of the feet. There are diagnostic equipments like plantar pressure scan or a 3D foot scan. It could be an ankle brachial index or a toe brachial index, which measures the vascularity in the feet. The plantar pressure scans or the 3D foot scan measures how much of your body weight is distributed on your feet and how it is distributed. Is it evenly distributed, or it is not evenly distributed? And it could be a neuropathic examination for a diabetic patient. So various of these diagnostics are not usually not available in a even in a large hospital perspective. Some of them do have. I mean, I would say probably about 2 to 3% of the hospitals might have these diagnostics, but most of them, the rest of them, do not have. And it gets important to use these diagnostic methods or a proper clinical examination of the feet, because as I said earlier, there are about 33 joints, and then each joint moves in a certain way. So you need to assess how each of these joints range of motion is there and other things before we prescribe something or design a footwear, a custom footwear or a custom insoles, or a custom orthosis for the patient. So these are the things that we need to address. First is summarizing it to your question. It could be plantar pressure scans, it could be 3D foot scans to measure the shape and the biomechanics of the feet. It could be ankle brachial index and the toe brachial index and the skin perfusion tests to measure the vasculature in the feet, and also measure the oxygen input into the feet. It could be neuropathic assessment, where we measure how the nerves are functioning in the feet. These are the top few of the diagnostics that is required to look at how the feet is functioning.
All right, sir. Also, there is a misconception I would like you to clear. Like, is there any difference between a foot doctor and a podiatrist, or it is the same thing?
No, it's not a misconception, but we do not. So there are, looking at the history, podiatry is probably of a recent origin, I would say, about, like as I said, about 70 to 100 years, where it came in. Before that, there were practitioners called osteopaths or chiropody, which was being done, which is majorly focusing on the manipulations of the bone. And as I said earlier, we have 25% of the bones in the feet. They used to also manipulate the bones in the feet and try and cure it. But I would call them as chiropodists, or who are there usually in UK and US, and not much in the other countries, so as to say. And the other category would be foot and ankle surgeons, who are typically orthopedic surgeons who have done a fellowship in foot and ankle and would be treating a lot of foot and ankle surgeries, or doing a lot of foot and ankle surgeries. Again, that category would be limited to about doing a surgical intervention. It could be a fracture or a fusion of the feet, of the bones of the feet, and other things. But in terms of a comprehensive care, which might include a basic nail care to the geriatric patients, or it could be correcting some fractures, correcting bunions and other things, will come under the under a podiatrist's domain. That's how I would difference. There is foot doctor is something very anyone who manipulates the feet is considered a foot doctor, but podiatrists are someone, at least in the West, they learn about 4 years of specialization before they become a podiatrist. But in India, even a 6 month course in a clinic will term them as a podiatrist. So it's not there in India yet, so people do not know about podiatry, what it means. They always confuse podiatrics to pediatrics. They think that it is the same, whereas pediatrics is more for kids and podiatry is for foot and ankle. And if you have an ailment with regards to the foot and ankle, I think you should search out for a podiatrist and meet them, rather than going to a physician or an orthopedic surgeon.
Okay. And as you mentioned earlier, I've said many times that diabetes is one of the most common, diabetic foot problem is one of the most common foot problem. Can you suggest anything which can prevent it to our audience?
Uh, One of the things that I always say is you need to treat your feet like your face. Typically you see your face in the mirror, you take care of it, apply some moisturizers to it, apply, keep it pretty. So similarly, you need to see your feet every day, ensure that you apply your moisturizers and cut your nails correctly and keep it pretty. If it's the smallest change that you see, it could be a change in the color of the feet, or it could be a small scratch, it could be a small scar that comes out in the feet. Go to your nearest physician, your diabetologist or a podiatrist, that you know, and meet them. Do not ignore any of the smallest difference that you see in your feet, because that could lead to a drastic outcomes like amputation. Until you had diabetes, your wounds would heal. Even the wounds that happen in the hand or anywhere else in the body would heal, without any problem. But once it happens in the feet, it's going to be a huge issue. So always wear a footwear, if possible, even inside the house, so it will protect you from hitting the doors and the walls and other things. Ensure it's a proper footwear, which where your feet can fit in properly, not too tight, not like a high heel shoes and other things which will alter the structure of your feet. And ensure that you see it at least twice a day, all over the feet, and see that if there is something wrong, even if there is a slightest blemish, please meet your diabetologist or a podiatrist.
Absolutely well said, sir. Thank you so much for your time. I just have one last question from you. Do you have any message for our audience?
Message for the audience, yes. So as if you have a foot and ankle issue, please look out for a podiatrist or a podiatric surgeon around you, rather than going out to any other specialist whom you think. Or and also do not ignore the foot and ankle problems, because that's the foundation that's going to carry your body all over until you're living. So please take care of that.
Thank you so much, sir.